Strategies for Change, Disability Policy and Practice in Ireland with James Cawley and Claire Kenny.
Hi everyone, my name is James Cawley and I'm the Policy Officer with Independent Living Movement Ireland, and I'm delighted to be delivering on this Strategies for Change session around disability policy and practice in Ireland. I suppose by way of introduction, Independent Living Movement Ireland, you'll see we have hyperlinked the link to our website there. We are a national cross-impairment disabled persons organisation. We're led by and for disabled people, and our strategic priorities or aims are around housing, around transport, around employment, and the independent living support called a personal assistant service. All of our policy submissions and key policy documents are all fed in through with the lived experience of disabled people. They're authentic representation, authentic submissions, and they allow people to have their voices heard in all policy areas that impact on their lives. One particular area that I want to talk about is around housing, is the National Housing Strategy for Disabled People 2022 to 2027. So this is a new strategy that has been developed, I suppose, amongst the backdrop of a lot of previous strategies. Namely, there was the National Housing Strategy 2011 to 2016, which was rolled over to 2020. And this strategy, what was really interesting about this particular strategy was when we researched around the lived experience of disabled people, it was very clear and apparent that disabled people were not part of that discussion around housing and around housing policy at local structures in their lives. So this new strategy, I suppose, aims to involve the lived experience of disabled people among a few specific themes, which I'll talk about on the next slide. But just on this slide, it says that the National Housing Strategy for Disabled People 2022 to 2027 is to facilitate disabled people to live independently with the appropriate choices and control over where, how, and with whom they live, promoting their inclusion in the community to further enable equal access for disabled people to housing with integrated support services. So I suppose there's a few key words and issues there that is important for disabled people to live independently, around us having choice and control, but around promoting our inclusion in the community as well. And I suppose this ties nicely in with a policy context around Article 19 of the United Nations Convention on the Rights of People with Disabilities, which states that disabled people should receive and be involved in the community equal to others, and get, again, in line with this strategy, getting to decide where and how and with whom they live. This specific strategy 22 to 27 has 6 themes. Theme 1 is around accessible housing and communities. Theme 2 is around interagency collaboration and the provision of supports. Theme 3 is around affordability of housing. Theme 4 is around communication and access to information. Theme 5 is around knowledge, capacity, and expertise. And theme 6 is around strategy alignment. Now, I won't go through each of the themes, but I think it's important for us to say that when we look at, for example, theme two there, and why this is important to have interagency collaboration and the provision of supports, or what that means is basically that we know from consulting with our members that disabled people might get the offer of a house, but then sometimes can't take the house if they don't have the provision of support set up or funded, for example. And that is where we find that disabled people find themselves caught in a catch-22 situation where they might get the offer of the house, but they don't have the offer of the support services or package even. So this strategy and theme 2 of the strategy looks at having more interagency collaboration by trying to link up the jigsaw or have more joint up thinking around where the local authority, for example, might communicate with the HSE. HSE might link with the support services or the service providers providing the services for people to live independently. So that's a welcomed, I suppose, theme within this strategy. Also, theme 3, for example, when we look at affordability of housing, lots of disabled people are saying that they actually are finding it difficult to afford housing. So, for example, if you work and are a disabled person, you can't apply for social housing, for example. So there should be schemes in place to allow you to access private rented and private purchasing market as well. So that's something where we need to see real tangible change as well for disabled people to be able to buy and rent in that market. Theme 4, I suppose, is when we often think of accessibility, we think of ramps and steps, but accessibility is much broader than that. We need to think about communication and access to information. So this strategy aims to, and in fairness, in the consultation process, it had a very strong accessibility focus where it had all forms of communication and information, even in the consultation process of this strategy, that it was accessible for every disabled person to be able to access. So for it was diverse in its approach in terms of people's impairments, which is really, really good. I finally just go through even looking at theme 3 around strategy alignment. This strategy needs to align with other strategies to enable disabled people's participation as well, and other kind of human rights and equality policies and legislation as well, because there's no point this strategy running along itself. It needs to link in and have a cross departmental approach, linking in again with that theme 2 of interagency collaboration as well. To highlight with for you as well, on this slide it says housing and our housing rights, and it's hyperlinked here on this slide as well. This is basically a report that we did with Inclusion Ireland around what were the issues and what were the solutions, or what do we need going forward to have a full strategic approach and a strategy to inform but also enable and empower disabled people to live independently. So last July, we did 6 consultations, 4 with disabled people, 4 groups with disabled people, and 2 consultation groups were facilitated by Inclusion Ireland with allies, supporters, parents and carers as well, around the housing issues that disabled people face and their families. So some of the issues that were highlighted were that we all know we're in a housing crisis, but that catch-22 that I talk about between housing and supports, around trying to get a house, but then trying to get support and getting them both to link and vice versa to enable us to live independently. But also another issue was around the complicated application process that disabled people face in relation to trying to get a house. So for example, it's not a standardized application process. So it varies from local authority to local authority to local authority. But with that as well, really, really long waiting lists. So some disabled people are years and years on these waiting lists, and that really needs to change to enable disabled people to have access to housing, choice, dignity, and respect as well. Another key thing was the inadequate housing grants. A lot of these housing grants have a fierce or a very strong means test that is a barrier for disabled people to access these grants as well. So that's something that needs to be looked at. And we do welcome there is a housing consultation on the housing adaptation. The deadline is the end of this month. So ILMI do look forward to hosting a consultation on the 20th of July around these harsh mean tests around housing adaptations. And we look forward to submitting our policy paper or submission on that as well. Overall, one of the big issues were around the lack of accessible housing as well, because what we've seen is that lots of houses can be accessible in inverted commas, but they're not wheelchair user livable, which is really, really difficult. So if you search on daft.ie and put on the filter for wheelchair accessible, you would probably get a few houses that say they are wheelchair accessible. But this is where we see the policy versus practice issue again, where it's been promoted as an accessible house, but lots of people can't actually live in the house. And again, accessible information was an issue around housing as well. So those for maybe with intellectual impairments or those who process information differently found that information around housing is not always accessible, and that there is not always the supports there to enable people to, for example, fill in forms to access housing, etc. And that's also a difficulty and an issue that came up in this consultation uh, process, but also in this campaign that we did along with Inclusion Ireland. So what we need is a few things: a central, uniform, accessible application process for housing and support, so that it's not this postcode lottery that if we're in one county versus another county, that it's different in each area. So we need a central, accessible application process where both housing and supports all communicate together. We would call also for a review of Part M, which is the building regulations that states buildings need to be accessible and housing need to be accessible. But we would be calling that actually housing needs to be livable for disabled people. Also, we're saying that there needs to be ring-fenced housing that's accessible. So a certain percentage of housing, all housing, whether that's social housing or private rented or private accommodation, needs to be accessible for disabled people to be able to participate in the housing market as well. Also, this idea of universal design needs to be implemented. So it actually opens up housing, not just for disabled people, but for people who are maybe older or those who have other mobility issues or other impairments, who can all access housing market in an inclusive way and in line with building genuine inclusive communities as well. Affordable housing as well, this is something that we need to see more of. While we see that it is a theme in the National Housing Strategy for Disabled People 22 to 27, we believe that there needs to be more done to make sure that disabled people, given the cost of disability report that we've seen in December 21, that states that disabled people incur a cost of 9 to 12,000 in addition to living generally. We know that we're in a cost of living crisis as well. So affordable homes and affordable housing schemes need to apply to what disabled people actually earn and not the market value, to allow us to participate in this housing market. And then this links in with then housing being linked in with building genuine inclusive communities. And what we mean by that is there's no point giving a disabled person a house out in a green field site for maybe a person who doesn't drive, for example. So houses need to be built in communities that are accessible by transport, that are accessible to amenities such as post offices, pubs, shops, etc., and that are close to employment opportunities and education as well. So this particular report is available on our website as well on www.ilmi.ie, where it's also available on www.inclusionireland.ie as well. I'm now going to hand you over to my colleague Claire to talk about how ILMI have worked together for seeing how housing can include disabled people, and to talk specifically around two programs that have worked and continue to work on including the voices of disabled people in housing. So I'll hand you over to Claire now.
Hi, my name is Claire Kenny. I'm policy assistant, but I'm also a proud graduate of the Strategies for Change program. I completed it last year, so I'm delighted to be back in this space. It's very, it's like being back with my old friends and old colleagues, and it's great. But I'll bring you through the two projects that we've had going, because it was unclear from the last strategy Jane was talking about, the National Housing Strategy for people with disabilities, if if disabled people were actually at the table. And the aim of these two strategies, or these two programs, was to enable disabled people, to equip them with the skills and confidence to be part of you know, the HDSG's Housing Disability Steering Group. So I'll now briefly outline making inclusion a reality and what that is. So through making an inclusion reality, ILMI worked on a model of best practice which was rolled out in South Dublin local authority region. The project was about disabled people informing the development of housing policy through the HDSGs. The project was also about establishing models of best practice for public bodies in how to engage with disabled people in the design, delivery, implementation and monitoring of policies that impact our lives. Some of the results of making inclusion reality were the establishment of networks of disabled people across South Dublin County Council area with a values-led approach. It built the confidence of disabled people to represent the views of all disabled people in their area effectively. As a result of the project, two ILMI reps around South Dublin County Council area, and the report of model of best practice is available on both the inclusion and ILMI website, as James mentioned. Secondly, during the development of the national strategy, a number of local authorities were reviewing their membership of their HDSGs and welcomed the contribution and expertise of the voices of lived experience. ILMI developed a training program and a series of presentations and inputs which allowed people who are interested in becoming representatives on their HDSGs to be informed when nominated onto their HDSGs and attending meetings. Topics included representation, effective participation, rights, universal design, networking, negotiation and dealing with conflict. And just to say that you've probably seen from our e-bulletin and on the ILMI website and also on Facebook that we're now taking interest in a new cohort to join the new housing network. So if James, you can inform James if you're interested. And I think for the strategies for change group in particular, this is where you can put your kind of policy learning and what you've learned from the strategies for change into actual meaningful participation. So, and I personally have been involved in the housing network, and I now am on 2 HDSGs in the, you know, I attend 2 meetings. So yeah, it's very helpful and I'd highly recommend it.
Thanks a million, Claire. And yeah, I couldn't agree more. I think it's a really good way to put your activism skills into action in a collective way by joining the Housing Disability Steering Groups known as the HDSG. So as Claire said, if you're interested in getting involved in the next cohort of the ILMI Housing Network, you can email myself or Claire and we'll give you the email addresses at the end, or I'm sure Fiona will share them as well. So just to go on to the next piece around campaigning for change and an example around that, you would have heard me a little bit earlier talking about independent living supports. And one of the independent living supports that we campaign on an awful lot is around personal assistance services. And I suppose what personal assistance services is a service that allows disabled people to have choice, dignity and respect in their lives. It's basically a service that allows disabled people to participate in you know, getting up every day, to live in a house independently, to go into education, employment, but also to also engage politically, economically, culturally, etc. So while it is a service, personal assistants are people who work um, for us, because quite often people say, "Oh, is that a tool, or is that an assistive technology, or what is it?" But it's actually, personal assistant service is um, are people who work for us, for us as disabled people, to allow us to get up in the morning, to decide when we eat, to decide when we take lunch, decide when we have a shower, get dressed, etc., and participate in the community. And it's Article 19 of the UNCRPD, or the convention, that states that disabled people, as I mentioned, have a right to access this service, and a range of other in-home supports. And that's important to say, because the personal assistance service is not the only service for disabled people. And some people don't use a personal assistance service. They might need or use other support services or independent living supports. But for the context of today, and campaigning for change, this is an example of how we have campaigned for change. So after the personal assistance service was introduced in Ireland in 1992, and 30 years on now, there still is no legal right to a personal assistance service. So ILMI began work to change that in 2018, where we consulted with our members um, around the country, and we came up with political lobbying workshops. And with our members, we defined 5 key areas, or 5 asks, that we wanted the government to listen to, and to make change. And the 5 asks were to define, to legislate, to invest, to standardize, and to promote. So that's on the slide here. So the first one is around a definition, because there's no universally accepted definition on what a personal assistance service is. So it kind of varies from community healthcare organization area, or CHO area, which the HSE is divided into. And it kind of differs from service provider to service provider as well. And in some cases, the personal assistance service can be very care focused, which gets away from what the personal assistance service was originally set up to do. It was originally set up to give disabled people choice and control over their lives. So that's why it's really important that we empower disabled people to make sure that they are able to question if their personal assistance service is falling into a medical model of disability and is more care focused, that you are able to say, well, actually, I need to be able to lead the service. I want this service to be what I want it to be, so I can live my life with choice and control over my life. So with that, ILMI have been trying to look at the second ask around getting legislation in place under Article 19 of the Convention, and in line with that, to make sure that disabled people do have a right to a personal assistance service in Ireland. But legislation is fine in one way, but with legislation we need investment. We need the money to follow through, that disabled people have the investment to make sure that this legislation stands, and that we can actually get the appropriate and adequate support services that we need, and hours that we need as well. But also the fourth ask there is around standardizing, because again, if you look at Ireland, it's split into the 9 community healthcare organisation areas, or CHO areas, and we're saying that we need to eradicate and eliminate the postcode lottery that exists in Ireland, and we need it to be standardised, so disabled people, no matter if you decide to move to Cork or Kerry or Longford or Mayo in the morning, that you get to bring your service with you, and that there is portability of services as well, so you have full choice and control over your life. The final ask is around promoting the service as well. So lots of disabled people don't know about the personal assistance service. So you should be able to link in with your local HSE office and apply for a personal assistance service. And then that's where you then probably have to engage in a needs assessment around getting a personal assistance service. And do get in touch if you are interested in starting your journey on getting a personal assistance service, because myself and Claire, and indeed Fiona can link you with our peer mentor as well around starting your journey around an independent living support, if that is a personal assistance service as well. It's important to say around then after these 5 asks were developed, we did engage with NUIG on looking at a report on international practice on personal assistance services. And we looked at kind of 3 kind of pieces of legislation or best practice, if you like. And what was the standout piece was that there should be standalone legislation for personal assistance services, but also a budget allocated to personal assistance services itself, because currently personal assistance services are bunched in with all home supports. So we would be looking for them to be unbundled so disabled people can decide what they want to use their funding for, if that is, say, for example, a personal assistance service. And the next point is around the capacity review, and that basically talks about what the level of service is out there. So it's saying on average, some disabled people are getting maybe 1 or 2 hours a day. Some people on average are getting 12 hours a week. So when you divide that out over the 7 hours or 7 days, sorry, that is less in some cases, less than 2 hours a day, which is not independent living if we need that support, that level of support that's appropriate and adequate for us to live independently. So again, we would be calling on the government to make sure that disabled people have adequate and appropriate support to live independently. And as you look at that report as well, you'll see as you go up the hours, so the more hours disabled people get, we see that less disabled people are getting more hours in that report. The next point says report showed standalone legislation, so I talked to that. And the next point says ring-fenced funding, so I also talked to that as well. But I will talk to the next point, which says that Sweden shows a gold standard in relation to personal assistance. So that's where we need to look at kind of when we're looking at international comparisons as well. The final point on this slide talks about the PAS motion, or the Personal Assistance Service motion. And this was a motion that we were able to bring through Deputy Thomas Pringle in November of 2019, which seen that we got cross-party support. Given COVID and a general election, we were able to then follow on and get local support in all local authorities. So 30 local authorities apart from one. But this local authority has given us support in relation to tabling and supporting the motion in the coming weeks. And what this means then is that when we have all 31 local authorities, that we will be able then to progress from a grassroots level and a national level in progressing with debates in the Shannon and the Dáil and looking towards a bill and introducing a bill into both houses of the Oireachtas to make sure that we move towards realising a right to a personal assistance service in Ireland. I just want to finish off by saying that there's loads of hyperlinks on this slide, and I will share this with Fiona as well, so you can click on this slide around getting access to our website, on resources around housing, around our personal assistance service campaign, but also there's podcasts here as well with disabled activists where you can listen to them. There's videos, there's a piece on language, on our on-site project, an online concert if you want to have a bop and a dance that we did throughout the COVID-19 pandemic, but also our submissions, but also key policy documents as well. And also if you want to sign up to our e-bulletin, which Claire mentioned as well, which gives you policy updates, but also peer and social gatherings. And that is out every 2 weeks, and you can sign up to that by emailing info@ilmi.ie. So that's info@ilmi.ie. And then I suppose some top tips in relation to advocating for yourself, but also when you're going into meetings and looking at a collective, so bringing this individual activism into collective activism. It's really important that we prepare for meetings or phone calls, that we even write down some questions we might have, that we take notes of any meetings. And a really simple one is to even just get the name of the person you talk to. So it gives you that kind of piece where you can go into the next meeting and say, I was talking to Fiona there, I'm just looking for an update. And this feeds into the next point, that we date everything. That we can say that we were talking to Fiona on the 17th of June and we're looking for an update. You can also ask for follow-up and what is the next steps, but also to be okay to ask for support. And I think that's really important, that we all need support. And I know Fiona talks about this, that we're all interdependent on each other. And I think that's important, that we are empowered to ask for support and help and assistance if needed as well. And that's again where we see this advocacy shift from just individual advocacy into collective activism, where we're able to recognize that we all need support and assistance and help. And we're not all experts in one area, and that we can chime in with peers and link with collective activism as well. And just to say, if you want any more information, you can contact me on James Cawley at ilmi.ie, or my colleague Claire Kenny at ilmi.ie, or visit our website, as I said, www.ilmi.ie. If you have any specific queries in relation to Inclusion Ireland, or the report from an accessibility point of view in terms of information or communication, you can contact Julie Helen, who is the Communications and Information Manager in Inclusion Ireland, on julie@inclusionireland.ie. And don't forget, you can follow us on Twitter, Facebook, or Instagram as well. Many thanks for listening, and talk to you soon.